I started studying this drug that we use a lot in rheumatology called methotrexate. And I was really curious whether bacteria have enzymes to metabolize methotrexate. But what I found is they do have enzymes to metabolize methotrexate, but that methotrexate also acts on bacteria. And that was a total surprise because drugs like methotrexate, other drugs that we use in rheumatology, were not developed to target the microbiota. They were developed to act on host cells, on human cells. But I found that they do, in fact, act on microbes. And then that brings up the question of, well, what does that mean for the patient? Is that why some patients experience, a little bit of GI upset on the days that they're taking methotrexate? And is that a good thing or a bad thing? And, one of the things that I have found is that, because the microbiota is so tied to the immune system, and we actually think that the microbiome may contribute to some inflammation in rheumatoid arthritis and in other inflammatory arthritides, that methotrexate may actually be acting on the microbes to reduce inflammation. So in addition to acting on immune cells in humans, methotrexate may actually be acting on your microbiome as well, to lead to less inflammation in rheumatoid arthritis and possibly other diseases. And so if that's the case, that would be really interesting to know, because we don't actually have therapies directed against the microbiome right now to treat RA. And so, if we understand how methotrexate and other rheumatologic drugs act on the microbiome to reduce inflammation, that's going to be really powerful knowledge to develop new therapies, or to, develop diets that affect the microbiome in similar ways. And so, the short answer to the question is yes, probably we have evidence for at least one drug, methotrexate, acting on the gut microbiome. We think that might be one of the ways that it actually works to reduce inflammation. And I would not actually at this point say that we have enough evidence to suggest that you talk to your doctor about switching therapies, because that might actually be the thing you don't want to do with methotrexate acting on your microbiome to reduce inflammation. But we're still learning about all other kinds of drugs too, like azathioprine and hydroxychloroquine and leflunomide. I think that those are all active areas of investigation in my lab and in other labs too.